So current clinical trials are looking at the use of neoadjuvant third-generation EGFR-TKIs and comparing them to the use of chemotherapy or TKI plus chemotherapy in that setting. So it's the NeoADAURA trial, which is ongoing. I hope we'll give a more definitive answer as to the clinical applicability of neoadjuvant EGFR therapy for this patient population. And there's some broad questions what the goal might be of neoadjuvant TKI therapy. Is it going to be to improve disease-free survival and overall survival? We certainly hope so. I don't think we know yet whether adding in the neoadjuvant space will that make a difference. We already have 3 years of adjuvant therapy. There's other questions about whether this might be able to take patients to less morbid or less extensive surgical resections and lead to better outcomes for patients in that setting, or even convert patients with borderline resectable disease to resectable disease. These are all spaces where drugs with high response rates may have a clinical role. I think long-term, we're really interested in neoadjuvant therapy in the hopes that it will give us surrogate endpoints for outcomes. So looking at things like a pathologic response rate or like mechanisms of persistent disease biology within patients' individual samples in the hopes that we can use that neoadjuvant therapy to inform our understanding of the patient's disease and response to therapy to improve their post-surgical management as well.